In this video I'm going to talk specifically about the structural causes of back pain, or more so what I typically see as the most common structural causes of back pain. As we know, back pain can be caused by biological, psychological and social factors, so this is going to focus very much on the structural and biological factors. So the concept I use to explain this is the concept of COGs, which is from anatomy and motion. So it's this idea of mechanical COGs, and as one moves it has a knock-on effect and it creates opposition in the cog above it. So we think of the pelvis, rib cage and skull as cogs, and so as, say, the pelvis tilts forward, this creates this extension in the rib cage, and then we have that opposition again at the skull, which maps the pelvis. So as you can see here, as one moves one way or as it moves the other way, it has a predictable knock-on effect up the chain. So this is what we would call sort of ideal spinal mechanics in this plane of motion. The issue arises when one segment here, or parts of a segment, say at the pelvis, at the ribs or at the skull, isn't able to access a certain movement. It's either not able to move out of a range of motion, or it's not able to move into a specific range of motion. So the most common ones I see are that either the rib cage is stuck in extension and the ribs are kind of flared, or the pelvis is stuck in an anterior tilt forward, and that has a knock-on effect up and down the chain. So before we get into that in more detail, the most important thing I see, and the most important thing that we need to address, is breathing. Breathing, we do roughly 30,000 breaths in a day, and the movement of the diaphragm and its ability to properly contract and relax and lengthen, its ability to do that literally drives these mechanics in the spine. And because it's such a fundamental function, and because it's, there's nothing that's more important than breathing in our day-to-day life. It's like doing 30,000 repetitions of a specific movement. Because that's so important, unless we address that, I often find it's pretty pointless going after anything more fancy. So as you can see here, as we inhale through the nose, down the throat, into the lungs, the diaphragm, so just to begin, the red is sort of like a resting position. The red represents the diaphragm here, and the abdominals in a neutral, we'll say neutral and resting position. Blue represents what happens during an inhalation. Green represents what happens during an exhalation. So the diaphragm has this natural dome shape, and in a resting neutral state, we'll say. As it contracts, it actually flattens down. So as the lungs inflate, they push, it's the contraction of the diaphragm as well as the pushing of the lungs as they inflate. They push your organs down towards your belly and towards your pelvis, which creates this sort of beer belly appearance. So it's not that you're breathing into your belly as such, though that's a nice way to think about it. It's that breathing properly down into your diaphragm, it just forces the actual movement of your internal organs, and that gets into internal organ massage through breathing, which can be really effective for general health. So as we inhale, that belly expands out, and this creates this extension, this tilt back of the rib cage, and this what we call an anterior tilt, or a tilt forward of the pelvis. And you can think of the pelvis like a bowl or a cup of tea, and it spills forward as you inhale because it's being driven by that force down. And then as we exhale, again that's that green line, the diaphragm is pulled up as the lungs are emptied, and that sort of draws all of that. It's almost like a suction, and it helps to think of the breathing mechanics as like a pressure system of valves. It sort of draws this diaphragm up into the rib cage, and that's when it lengthens fully. And that's really important, being able to create that fully lengthened diaphragm. And what that's going to create structurally is this tilt forward of the rib cage and this tilt backwards of the pelvis. So it's like a drawing in of the belly button, like this, and almost as if you're collapsing down and sinking down through your chest. If I do this and draw my diaphragm up as I fully exhale and draw my belly button in, that's accessing a maximal diaphragm lengthening. So usually what I see is that people are stuck somewhere in here, and this gets into posture. There's no such thing as a bad position really. What we want is access to the full range. So the extreme end of the blue is the end range here, and the extreme end of the green is the end range here. The red represents that resting point. In anatomy and motion we call that center rather than neutral. And so what we want is we want access to both ends of the spectrum, and ideally a nice resting point at center. So the first thing I do with people in back pain is assess their ability to do this. Can they smoothly contract their diaphragm and breathe down into their belly? And can they lengthen it fully? Can they fully empty the lungs and draw that belly button in and really create that high dome diaphragm position? What you'll usually see is they really can't do that, and in terms of actually shortening their diaphragm and contracting it, it's very stuttery, it's a lot of effort, and it should be a very smooth, natural motion. Again, if we want to do it properly 30,000 times in the day, we want it to be nice and smooth and effortless, and breathing should be something that's happening unconsciously. So that's the first thing that we look at, and I'll give you exercises at the end to address that. The next thing I tend to see very commonly is, because most people who come in there tend to be posteriorly tilted here at the pelvis, anteriorly tilted forward, spilling forward. They tend to have this overarched low back. Again, there's nothing inherently wrong with that. We know that it's not about the position itself, it's about the lack of movement. So you can be stuck here, and that's fine. It's not necessarily any worse or better than being stuck here. It's just we want to have access to opposite ends of the contraction, and we want to have a nice resting point in the middle. So people come in, they tend to be tilted forward, highly arched in that low back. The issue with this is that they also tend to have very tight hips, or the inability to extend their hips. So that doesn't mean that their hips are tight, it means that they lack the ability to voluntarily create a hip extension. So when we walk, we need to push our center of mass forward in order to travel forward. So our center of mass is our pelvis, and in order to create a shift forward of the center of mass, the ideal way is to create a hip extension, which basically comes from a glute contraction. So this glute, this red muscle here, as it contracts, it pulls the leg back, or it propels the pelvis forward. That's our ideal way of creating a shift forward in our center of mass. Because people, pretty much almost everyone I deal with who has back pain, they have very little voluntary control of their glutes, because they've got no real connection there, and they tend to have overactive low backs. The way they translate their mass forward is through a lumbar extension. So what you can do, rather than contracting here to push yourself forward, you can contract the low back in order to shift yourself forward. So what you'll see is that when people walk, as they push off, they're not really extending, they're actually hyper extending the low back in order to move their mass forward. So those are the two most common things I see with people with back pain. Everything else, it tends to be highly individual in the way that your COGs have been set up. So this view of the COGs is very much in what we call a sagittal plane. It's forward and backwards movement. We see the COGs relationship in the transverse plane, which is rotation So as I walk, my pelvis will rotate this way naturally, my rib cage should counterbalance, and my head should counterbalance to keep my eyes level on the horizon. And then similarly in what we call the frontal plane, which is side to side movement, as I step forward, I should naturally have a bit of a hike here, just because of the mechanics of the joint and their position. And in order to keep my eyes level, because if I hike this and I keep my spine straight, now I'm here. So I need to counterbalance with the rib cage and then counterbalance with the head to keep the eyes level. So again, it's this COG relationship. As the pelvis hikes, it creates a counter tilt in the rib cage. So more, not unusual, but less common instances of back pain, it's usually some combination of one of the COGs, one of the components, be it the pelvis, the rib cage, or the head. And you can map this down all the way to your toes, to your fingers, but usually somewhere between the hips, pelvis, ribs, and skull, one of the COGs is not able to move fully into a position or fully out of a position. So I'll give you exercises for that at the end.